Hello, everyone, and welcome to the World Affairs webinar with CARE, Gender Dimensions of COVID-19. Thank you for taking the time to join us today, and thank you again for your interest in this important topic, how the COVID pandemic is impacting women and girls. I'm Christy Chin. I'm a World Affairs board member and your moderator today. This program today is brought to you by World Affairs, Global Philanthropy Forum, and CARE. World Affairs convenes thought leaders, change makers, and engaged citizens, share ideas, learn from each other, and affect change. During this time of social distancing, all of our programs have transitioned online, and we encourage you to continue to take part in these important conversations. The Global Philanthropy Forum is a special project of World Affairs. GPF, as we call it, is a peer learning network of philanthropists and social investors committed to advancing international causes. GPF seeks to build a community of philanthropists and enhance the strategic direction of members' giving through programs like today. We'll be hosting our annual conference, we hope, in person, September 14th through 16th. More information about GPF and World Affairs programs are online, so please feel free. I see Claire's already added that to the chat box, which is where we will also be taking questions, so feel free to post your questions there. CARE was born in 1945 when Americans assembled care packages for individuals in war-torn Europe. CARE is celebrating its 75th anniversary, congratulations, delivering humanitarian aid around the world. CARE works in the hardest to reach places on Earth to support and protect the populations who are most vulnerable to health crises and pandemics. It's my pleasure to introduce you to two incredible speakers today. Susannah Friedman, is CARE's U.S. Senior Director for Humanitarian Programming and Policy. She's also an adjunct faculty member at Columbia University's School of International and Public Affairs. She started working in international affairs as a Peace Corps volunteer, and I hope there's some Peace Corps volunteers listening today. And since 2005, she's been managing and advising humanitarian emergencies around the world, starting in Eastern Nepal, and then into Somalia with Save the Children. And then she joined CARE, where she's been working in the Sudan, Asia, and the Pacific. Thanks for joining us today. Simran, am I saying it right now? Yes, okay, good. Simran is the Director of Global Strategy and Gender Equality at CARE Canada. Finally home after so many years abroad. She's also a member of CARE's Global Gender in Emergency team. She's previously worked for both the Canadian and British governments, as well as the UN Refugee Agency. She's been deployed in incredible places: Pakistan, Kenya, the Philippines, Ethiopia, and Jordan. Please join me in welcoming these two extraordinary women as our panelists today. So please continue to put your questions in the chat box. We'll be monitoring that, and after about a half an hour, we'll turn to your questions so that you can participate in the discussion. Susannah, why don't you get us started by explaining why CARE focuses on supporting women and girls in humanitarian and development settings?
Yeah, thanks, Christy. So CARE focuses our work on women and girls because we know from experience that they tend to be the most vulnerable in settings of crisis. When emergencies happen, they exacerbate pre-existing inequalities and amplify them. So community and household dynamics shift. And while this can open up new opportunities, it can also create new risks. And women and girls tend to be most vulnerable to those types of risks, and they are disproportionately affected. And they sometimes have difficulty accessing food. So for example, they eat worst or they eat last in a household setting. They struggle to find healthcare services, shelter, and other really important resources that can save lives during emergencies. So during our years of experience, we have seen this any number of different times. And when I was thinking about this meeting today, I was reflecting on a mission that we undertook to the border between Colombia and Venezuela about almost exactly 1 year ago today, in fact, where we see this over and over again, and we certainly saw in that context the ways in which crises mean that women and girls don't have access to life-saving health services, notably sexual and reproductive healthcare services, struggle with food security, struggle with income, often have to turn to coping mechanisms that can endanger them. And so we see this over and over again, and we would expect to see it again now, which is one of the reasons that women and girls are at the center of our concerns at the moment, as we face what is inarguably the biggest global crisis in our lifetimes, and perhaps the only truly global crisis in our lifetimes. So as we embark on really thinking about how to respond to this crisis, I think it has really struck us that COVID has affected every aspect of everyone's lives. And that is particularly true for women and girls. And most particularly for women and girls in low resource settings, the types of places where we work in development and humanitarian crises every day. And our research has shown this, I think, to date. We were one of the first organizations at the outset of this crisis to highlight how the COVID pandemic was affecting women and girls in the policy brief that we published around the gender implications of COVID-19 outbreaks in development and humanitarian settings. Subsequent to that, we have published an additional 8 rapid gender analyses. We call them RGAs. And we are in the process of producing another 50 of those rapid gender analyses, looking at different contexts all around the world and the ways in which the impacts of this crisis are so deeply gendered. So for those RGAs, we use primary and secondary data. We look at gender roles. But most importantly, the real purpose of those RGAs is that when we don't ask the right questions, we don't get the right information to really understand what the impact is on people, and notably on women and girls.
Great. So it's great to hear that you have such a data-driven approach to humanitarian aid, and that you're doing those surveys and crafting, we hope, the right questions, right? What has your research shown about the gender implications of the pandemic?
Yeah, so I mean, I think, again, we have seen through the research that women and girls' lives have been changed in every conceivable way. And I think so many of us feel that in our own lives too, right? I mean, this is not limited to crisis context, but the implications are deeper because they cut right to the heart of lives and livelihoods. And so, we are concerned not only about the ways in which these impacts are felt in the immediate term, but also the ways in which these impacts as related to the COVID pandemic are likely to impact on the lives of women and girls for many, many years to come. Their access to services in terms of physical and mental health care, gender-based violence prevention and response, education, and so on and so forth. Access to these types of services is decreasing at exactly the time when those services are so profoundly needed. And so just to provide a couple of examples in the sort of realm of health, we know that women bear the burden of caregiving. And this is true in so many different places where there is an expectation that women are the primary caregivers for their families when people become sick, when people need other types of care, and that this places them at higher risk of infection. And also of the sort of emotional and physical toll that this can take. We know that women living in humanitarian settings and in development settings are likely to be or frequently employed in low-wage activities, and that these are going to be impacted by the pandemic, meaning that access to income will be limited. And obviously the knock-on effects of that are a real concern in terms of lives and livelihoods. And people are already feeling the impact of this. An estimated 90% of female entrepreneurs who participate in a project in Sri Lanka have already seen their income decrease in recent weeks, and 90% of those entrepreneurs reported that their supply chains were disrupted, right? So we can only imagine what this is going to mean down the line. Beyond that, in Guatemala, female entrepreneurs there report that they now find it difficult to satisfy even basic needs like food and water for their households, right? So we're seeing the knock-on impacts all down the line, both in terms of people's businesses and the ways in which this impacts on them personally. The president of a Guatemalan women's cooperative that we work with told us that COVID-19 has affected that group of women both economically and emotionally because they can't sell their products, their income has decreased, and they are deeply concerned about the worst case scenario. I think in the best case scenario that we are facing, we know that populations who are living in the margins, people who are vulnerable, will be badly impacted by this crisis. And I think the worst case scenario is actually unimaginable.
Yeah, it's, I mean, it's really unfortunate, but it's dramatically clear that your research has shown that women and girls are often disproportionately affected in the areas of health, education, basic physical protection, economic empowerment. I was just reading in preparation for this that even the Pope, or especially the Pope, who calls out for the most vulnerable, has called upon our leaders to say we need a just and equitable recovery from COVID. It's been, as you said, truly the first truly global crisis that we have faced as a planet. And so as you look at the 100 countries where CARE works, are women empowered to be part of the solution moving forward? I mean, the development community has long said those who are most affected often know how to improve their own condition. And, do the women and girls that you're working with, do they have a seat, do they have influence and power in being part of the solution moving forward?
Yeah, I mean, we at CARE believe that women are their own best solution finders, and are best positioned to identify and execute those decisions. But even though women and girls are so disproportionately affected by crisis, they are very, very often left out of the decision-making process that formulates the response to those crises. For example, even as late as 2018, only 56% of the crises that are monitored worldwide directly consulted with women's organizations in the humanitarian planning process, right? And so that means that women's voices and needs can really be left out of the solution. 443 million women are not connected and have no access, this is around the world, to digital technology. Women in South Asia, for example, are 28% less likely to own a phone than men, which means that they are left out of the ability to connect and help to drive decisions. So a lot of the work that we are doing really aims to put women in the driver's seat and to support them to identify solutions and drive that forward. I wanted to reflect just a little bit because I realized I didn't sort of mention some of the other ways in which the crisis is impacting on people, and particularly on women. One of the things that we see happening in terms of the ways in which women are impacted by crisis is that we see an increase in gender-based violence during crises frequently, and we would very much anticipate that in the context of this pandemic. I think we recognize the ways in which protection risks increase. And that is not only for women, but also for children who face increased protection risks. We also worry about the ways in which existing resources can so frequently be diverted. And so where women would seek primary health care, that just no longer is available to them as resources are diverted so frequently in order to respond to the pandemic. So there are a variety of ways in which the system overall is impacted, and that tends to have a really most significant impact on women and girls. And so those are some of the things that CARE is concerned about.
Well, it's clear that we have a long way to go. And thank you so much for sharing that context. While it's really hard to hear those facts, it's also hard to imagine the challenges that women are facing. I mean, if we think it's hard in the developed world, and we're even facing in our chat section right now some harassment. So clearly humanitarian aid is needed more than ever. So Simran, let's turn to you and see, how is CARE responding to this overall, to this, you're in the field already. So what are you continuing to do and what new things are you doing?
Thanks, Christy. First, I wanted just to take a moment and thank you for taking time out of your really busy day to moderate this panel. And I really appreciate World Affairs Council giving us this platform to talk about our work. So maybe before I actually talk about the specifics, I wanted to talk a little bit about how CARE works. So CARE is what we call a dual mandate organization. So we work in both humanitarian response as well as longer term international development work. And so what that practically means is that we're in communities oftentimes years before a crisis hits. Then we're working in communities while a crisis is happening, and then we're often there after a crisis ends. And I think it's really important to acknowledge that most of our staff are national staff. So they're either from the countries or communities that we're working in. And in our experience, it's really important with emergencies to continue our existing work, but obviously respond to the immediate needs. And do that in a way that's safe for our communities and for our staff and does not cause harm. So in addition to continuing our programming in the over 100 countries that you mentioned, CARE is responding to COVID-19 in 65 countries across the globe. So as of May 1st, for example, and these are some really big numbers here, we've reached 23.5 million people through media messages around hygiene and prevention. So,
We have a little internet issue there. Go ahead, keep going.
Okay, sorry. Is it, okay, sorry.
Why don't you just, I heard the mass media. So why don't you say the mass media number and then why don't you pick it up from there? How's that?
Okay, sorry about that.
That's okay.
So we have 23.5 million, we reached 23.5 million people through mass media messaging. So hygiene, wash your hands, what to expect around COVID, how to prevent it. We reached we reached 3.3 million people through actual direct community workshops, door-to-door visits, and working through local governments to share that messaging directly with communities themselves. We've increased access to safe and clean water for almost 1 million people. We've provided what we call hygiene kits, which are kits that often have things like soap, underwear, diapers, depending on the context, for around 841,000 people. We've also distributed food, we've provided cash, we've trained people, but these are just kind of a general sense of how many people we reached so far through this response.
That's amazing. I mean, you're already in the country, and you already have, the field workers, people who are really known and trusted representatives of their community. But I mean, in that just short time period, 23 million messages, reaching more than 3 million people with these meeting their basic needs and helping them with information that could be life-saving. I'm sure you're doing even more. So do you want to tell us more about how some of the programs are continuing? Because it sounds like the need is.
For sure. So I wanted to draw attention to the work that we're doing in Sierra Leone. So as many of you know, Sierra Leone went through the Ebola crisis. So we're at CARE partners with this amazing woman called Rosaline. Rosaline is a nurse. Rosaline actually paid for nursing school through being a community health worker herself. So she was a community health volunteer. She was paid a stipend. She saved that money. And in 2015, she was a frontline healthcare worker for the Ebola response. So she was at the front lines of providing support during a very, very difficult time. And now she actually gets on a motorcycle. She travels across her community and she shares messages about how to prevent COVID. What does this mean? Trying to dispel some of the rumors that might exist. And she herself has said that, it is difficult. And sometimes people don't listen to her, or they're hesitant, or they don't trust her. But what she says is that because she's from the community, she was born there, she was raised there, there's that inherent sense of trust around the work that she's doing, and because she is one of them. And so she's been able to really effectively spread those messaging. And she does that obviously at a great cost to herself. And so, we're very grateful to have people like Rosaline working with us. In the context of, say, Kenya, we have been working in the Dadaab refugee camp now for almost 30 years. The camp has been operational since the early 90s. And we've had to obviously pivot over the years for multiple reasons. But right now we realize that, girls need education, but there's social distancing in place. So how do we actually do that? So we've actually partnered with a radio with Radio Gargar, who are currently now actually broadcasting that messaging and the lessons that teachers are teaching across the radio, so girls can actually still continue the education. And it's really critical because if there's a stop, that means it's harder for girls to get back into school.
Excellent. Well, early on, people were saying, well, what do you say to your kids? And Mr. Rogers said, look for the helpers, look for the Rosalines in the world, and you'll see, and those will be the glimmers of hope and those extraordinary stories. So thanks for bringing that along. Are there other ways that you're, continuing to, are there other bright spots you can share with us in the midst of some pretty challenging statistics and data?
For sure, and I think both you and Susannah have mentioned the importance of women's leadership and women's voices and what that means, and making sure that women themselves know the solutions for their own problems. And this project this work is pretty close to my heart. We've been doing what we called Women's Voice and Leadership Programming in Kenya, and the idea is that we work with women's rights organizations and women-led organizations to build their capacity so that they're able to kind of continue beyond this lifespan of the project. And so when COVID happened, they came to us and said, listen, we know what our communities want. We know what the gaps are. We would like, small amounts of funding to be able to address some of these really critical needs. And so through that initiative, we're now supporting local women's organizations to do a whole host of things. So, one group came to us and said, there are women living with disabilities who aren't going to be able to access essential medicine. So we would like to set up a support to have them access that medication because they're not going to be able to go out to the clinic. Another group came to us and said, listen, like we know sex workers are going to be disproportionately affected, and they need a hotline to be able to report any violations. So we've set up a hotline, we've set up some social media accounts. We've worked like this, not we, but the women-led organizations have set up these hotlines and these mass media campaigns. And it's really inspiring because they're in their communities. They know how best to respond. And if the best way we can do is to listen to them, to hear what they're saying that they actually need, and then to be able to support that work. And it's been really inspiring to see that actually pivot and shift and respond to those needs. And you also mentioned the care package and CARE's genesis from around the care package and what that means. And so in April, actually, CARE announced its first ever domestic aid initiative in the US. The program will support monetary assistance, food, and essential supplies to individuals in need and at risk, including essential workers, frontline medical personnel, and caregivers in the form of care packages. So we've updated what it means to be a care package, because when a care package initially happened, as you mentioned, in 1945, it was food. It was food, and it was essential. And there was a package of spam in the care package. So obviously, we've now moved forward from sharing spam with people. And I've actually had the pleasure of talking to people who've received care packages, and it had such an indelible impact on their lives. And 70 years later, they still remember that specific package. And so we would like to do that here in the context of the U.S. And so the idea is we're unveiling a new care package. It's built to help people in the U.S. and overseas. And we're calling on all Americans to deliver support for healthcare workers, for caregivers, for the individual needs, for basically, like you said, help the helpers, the people who are helping us every day to make our lives that much easier. Let's provide them with support. And so our goal is really to create that tidal wave of support and gratitude for caregivers on that front line.
Great. Yep. In the wave of pandemic, it is amazing to see this wave of generosity, to see Giving Tuesday just this past week, and to see that people really are stepping up and stepping forward to be helpful. It really reminds me of a conversation that I had with the News Story team. It's a charity group that I've had the pleasure of serving on the board of, and they referenced this quote from JF Kennedy, which was that the Chinese used 2 brushstrokes to write the word crisis. The first stands for danger, and we should be alert to the danger that COVID brings, and the other is for opportunity. In a crisis, be aware of the danger. We should be aware, but we should also recognize the opportunity. So are there other places where there are opportunities that CARE has really been able to turn this around, right? To see the need for change and to respond in a timely way?
So, I want to start off with, I think we can all collectively acknowledge this is an incredibly difficult time for all of us, not, as Susannah said, not only in the countries that we're working in, but where we're at as well, like in Canada and the States. And it's really highlighting some of those structural inequalities that women face on a daily basis. But you know what, at the same time, it would be remiss of us not to try to do things better and not to see this as an opportunity for as a global community to build a more equitable world. And I think, as Arundhati Roy said, it's a portal, a gateway between one world to the next. And we have that, again, recognizing that there's a lot of limitations. It's going to be a hard work, but we have that opportunity to craft a more equitable world, one where there's gender equality, where people have opportunities regardless of race, gender, or sexuality. I mean, that's where we see that kind of value from CARE's end. And oftentimes when you work in humanitarian response, I've had colleagues who say you're seeing the worst that are impacting people. You've seen when people have lost their livelihoods, they've lost their homes, they've had to leave conflict. But I'm often struck by the inherent resilience of people and of women and girls. And I've had the privilege of talking to women and girls across a lot of communities, but I was talking to Syrian refugee women who were coming to CARE's community center to get support. And again, I was just really struck by the resilience of the resilience and the inherent strength there. And we need to be able to capitalize on that. We need to be able to build that world. We need to be listening to those voices, because that's what's going to make it better for all of us. And I think one thing this crisis has really highlighted is that what's happening in another community is going to impact my community. So the global is local. Like we cannot say if it's fine for us, we're okay. It's going to impact all of us, and it will continue to impact us until COVID is there's an actual long-term solution to this. So I think that's really important for us to talk about and highlight.
I love that the global is now local, and just thinking about recrafting a just and equitable recovery for everyone. So thanks so much for sharing those stories, the real resilience of women and girls. It's easy to see the Guatemalan woman or Roslyn or to envision some of the women and girls that you've mentioned. So many of us are concerned about what's happening and how the effects of the pandemic are affecting women all over the world. It's such a big issue. Climate change, how do we get a handle on these big issues? We want to do something, but it's difficult to know what to do. One of the reasons why I've been so excited to be on the board of World Affairs is that Philip has expanded, our new CEO has expanded the mission to say we shouldn't just have conversations that matter, but we should be spurring people to action. So maybe I'll turn back to you, Susannah, to see, are there ways that you would recommend that that people could be activated if they care about the gender dynamic at this moment in time, and how they could lend their time, talent, treasure to make a difference?
Yeah, and we do hope that they care about the gender dynamic at this point in time, and really inspired to see so many people here wanting to learn more. So there are three primary areas I want to talk about where I think everyone can do more and lean into this space. And the first is just to find out more, to educate yourself and educate other people about what is happening. And we've had an opportunity to just sort of glance over a couple of the ways in which the COVID crisis is impacting so significantly on women and girls around the world. But if you want to learn more about that, you can find our policy briefs, our rapid gender analyses, and we just published a report on women's economic empowerment in the context of COVID on our website. And I think we're going to post that link into the chat. And we would encourage people to read these resources and to share them. There's also a lot of advocacy that needs to be done. We are, in the context of the US, facing an uphill battle in Congress to ensure that there is adequate global funding for this crisis. And I think we cannot underscore enough the significant level of resources that are going to be needed to confront this crisis, both in the immediate term as well as in the recovery phase. So the humanitarian and development community has assessed an initial need, and this is just the immediate term needs, of $12 billion in additional global funding. And we are currently at a critical moment to get that message through to Congress. So there are two ways that those who've joined us today and friends can help with that. One takes just a minute, and that is to sign our petition in support of this $12 billion request. This is a community-wide effort, and so you can add your name by going to www.care.org/fightcovid, and I think that will go up into the chat as well. And then on the advocacy front, we also would encourage folks to join us for additional inspiration and action at CARE's virtual summit on June 9th. And we can post up the details of that event in the chat as well. But during that virtual summit, we're going to hear from political veterans like Valerie Jarrett and Stacey Abrams, global health experts like Helene Gale and Mark Dibble, and a range of other global voices who are going to share their experiences and the solutions of women leaders all around the world. So I think that'll be a very exciting event. And then finally, but I think critically, we as a humanitarian community are just significantly in need of resources to enable and facilitate the work that is so desperately required on the ground. And so we would really encourage folks to donate to CARE's COVID-19 response. As Simran mentioned, and as we've discussed throughout the course of our conversation, we are working in 100 countries. We are there before crises. We respond to crises. We are there after crises. We are responding to COVID now. We will be there for the recovery, working alongside local organizations, alongside women and girls. And that is really what our entire 75-year history is all about, is about helping communities and working to support local solutions. But we need help in order to do that. And there are so many organizations that need help, and we are not unique in that, but we are unique in our focus on women and girls and the ways in which we have this long-standing commitment to the communities that we work with. Our emergency teams right now and our country office colleagues right now are working around the clock to try to prevent further spread of this virus, but also to meet the immediate needs that are arising as a result of both the virus itself and the sort of secondary impacts around food insecurity, income shortages, and so on and so forth, health challenges, both in terms of COVID, but also in terms of the sort of ongoing sexual and reproductive health needs of women and girls. And we need help to do that. We are particularly concerned about people who are living in densely populated areas, people who are living in places where the healthcare systems, even before COVID, were already so weak and are now just stretched to the limit by this crisis. So we are working around the clock to try to support those systems, to try to support those communities, but our field teams need extra resources to do that, and they need those resources urgently. So we are grateful for those who wish to support CARE financially as well.
Great. Well,
and I think we were going to post in the chat the link for where people can find the donation.
Great. Well, I do think that hopefully we will see enormous generosity and volunteer efforts in response to this truly unprecedented pandemic that is truly global. I've already seen foundations tended to act pretty quickly, to start COVID funding and be able to allocate larger amounts of money to a COVID response. I've also seen just in the last 2 days that there's an effort that people are saying you should be spending half of your donor advised fund. And I almost see it like a challenge to the donor advised community to say, you should be treating that donor advised fund like a giving pledge and give away half of it, because there's a lot of money that's sitting in donor advised funds today. And I can't think of a more urgent time to deploy capital to help with the most vulnerable. And CARE is an extraordinary organization. Very few nonprofits that have existed for 75 years, very few are able to have the reach, the trust that CARE has. And also, I think the pivots. I mean, it's exciting to see what CARE is doing to pivot and start working in the United States. And so that's an exciting opportunity and might bring, what CARE does into our own backyards. Those of us that are sheltering in place, we might see a few care packages and maybe that will spur some of the generosity into the developing world. So thank you so much for sharing those, and they're all in the chat. Our first question is first, how do you think faith leaders and organizations and their organizations can meaningfully reach out to their communities and speak out against, and it says GBV and early focused marriage due to the fallout of the economic burden of COVID-19. I'm not as well versed in this issue, but maybe one of you are, being in the gender area.
Susannah, do you want me to take that one? So I think one of the things we didn't mention, but we say we work with women and girls. We also work with really key community leaders, such as faith leaders, because we recognize that it's one thing to talk to women and girls, but we also have to talk to the people who influence their community. And so it's been an approach of CARE to work with faith leaders, with community leaders, to have them support some of this messaging around gender-based violence prevention, around early forced marriage, to work through these communities, because they already have that trust. And so that's something we're definitely doing, and we see as a really critical critical part of our approach.
There is another question here. It's more of a thank you. I'm just seeing COVID can be stopped by many providers and stimulating the brain. Let's see.
I might also just mention on the gender-based violence point, while we're seeing if any other questions come up, that one of the other areas where I think there's an opportunity to work with communities is with teachers, and really working to keep education systems going in order to keep girls in school, to avoid that child early and forced marriage dynamic. And one of the areas where we are working is on working with education systems to try to ensure that education systems can rise up to meet the needs of children right now, but also to ensure that as communities and families are dealing with the kind of economic impact and economic fallout of COVID during the recovery phase, that they have options that don't force them to keep their children at home. And so I think engagement with the education system through local leadership is also critical.
Great. I don't know if you both can see the question, but there's a question from Laura around, she's wondering if the panelists, if they have found specific impacts on gender relations. I've heard from many the impact of women, I've heard mainly the impact of women, but in my view, they are quite similar to the general and social impact for everyone. Lack of access to healthcare, economic power. In other words, how is the pandemic affecting the role of women in society in positive and negative aspects? Thank you, Laura.
Simran, you want me to take this one? So, I mean, I think, there are any number of ways that this pandemic is impacting on the sort of role and perception of women in society. One of the areas where we have concerns are in relation to, because women make up 70% of the global health workforce and social care workforce, and because they also bear this burden of care at home when loved ones become sick and require other types of care, that there could be stigma around women and the sort of increased perception of their likelihood to be carriers of the virus. So there are concerns around just the general stigma that could be associated with women, particularly those in the healthcare workforce, as we move through this crisis. But I think also, the emergencies always impact on gender roles within society, and particularly on the role of women and how they are perceived. And I think from where we sit within CARE, those impacts are generally negative. They can be positive, they can be otherwise, but generally speaking, where there are pre-existing inequalities, those tend to be deepened by crisis. But there is an opportunity. And so I think as we look forward towards how we are both responding to the crisis in the immediate term, but also in the longer term, we really want to build back more equal, right? So looking at communities and the kinds of very profound changes that this crisis will have on all of us and communities all over the world, the ways in which we work with communities in the countries where we implement programming, I think we are very eager, both through our programming and our advocacy, to ensure that as we rebuild from this crisis, we are doing that in a way that empowers women, that allows them to lead the response themselves, to to sit in those decision-making fora and determine the way in which the response is going to be delivered, but also that they are positioned to be more empowered as we move forward, and to out of the ashes of this crisis build something better, we hope.
Mm-hmm. No, that's great. So the last question I think we'll have time for is a question around the intersectionality of so many of these issues. Climate change is also affecting women in a disproportionate way. And are you seeing ways that you could apply your findings with this corona response to the impacts that climate change is having on women and community and vulnerable communities?
Simran, you want to take that?
Sure. I mean, I think it's just showing how all of that is just building upon each other to exacerbate like inequalities, right? Because we were already looking at the intersection of climate change and emergencies and just prior to COVID happening, and the fact that that we're looking at climate change refugees, there's an increase in all that, and so this is all having this. Sorry, maybe I'm trying to think about how I say this, but we're basically reconceptualizing how we link our work around climate change to our work around COVID-19. And I think what we're realizing, that the really kind of critical thread across all of that is the idea that she leads in crisis. So how we're going to get through this climate change crisis and how we're going to get through this COVID and other emergencies is by supporting women's leadership, as exactly what Susannah was saying around building back a more equitable world, because climate change is already impacting us, and COVID is just another layer on top of all of this changes that's happening. Susannah, I'm not sure if there's anything else you'd want to add to that.
Yeah, I mean, no, I think that's exactly right. And, and we are, as we move forward, also looking at the sort of compounded impacts of all of these things, right? So as Simran mentioned, we were looking at climate change and gender, and now we're looking at climate change and gender and COVID. And the ways in which all of these things layer on top of each other, that discouragingly deepens vulnerabilities, but where we do think that there are opportunities to rebuild in a different way. We're actually engaged in a piece of work right now that looks at the ways in which our humanitarian responses have the ability to create transformative change in the gender space, and thereby sort of catalyze us and allow us as a global community to do exactly what we've been talking about around building back more equal. And so I think both in the ways that we deliver the humanitarian response, but then as we think towards recovery, need to look at that through all of these different lenses, and the ways in which people have been made profoundly vulnerable by these different layers of crisis, but where there is, I think, tremendous hope and opportunity to try to, as we rebuild from this, do that in a way that creates more resilience, makes people less vulnerable, and makes women more empowered and equal.
Great. Well, I think that's a wonderful note, optimistic note to end on, which is, in the face of incredible challenges, we often see ingenuity, creativity, and new solutions emerge. And clearly CARE is already at the forefront of that, working around the globe. The two of you have been incredibly courageous in your work to date, personally and professionally. And so we can't thank you enough for sharing all of your expertise with us today. And with that, I just would also like to share CARE. There was a team of individuals behind the scenes at CARE that were helping us prepare, as well as at World Affairs and Global Philanthropy Forum. So thank you all for your support. We all stand on your shoulders, and together I think we'll move forward toward a more just and equitable recovery. And stay tuned with CARE, their advocacy work, their education, their reports, as well as with World Affairs and Global Philanthropy Forum. And we'll continue to follow up on this gender issue throughout our programming. So hope everyone has a lovely weekend. Stay well, take care of yourselves and your family. And thank you again so much for joining us today. Thanks so much.
Thank you, everyone.
Thank you.